If you experience judgment or shame for requesting pain medications after your C-section, I have a story for you. I'm an obstetric anesthesiologist, and this is what I experienced when I had pain after my C-section. Before I had my C-section, I'd never had a surgery in my life, had never broken a bone, nothing. I'd also never taken an opioid in my life, nor did I want to. I knew the statistics, I knew the side effects. So after my C-section, I was doing all the multimodal analgesia things. I was keeping up with my Tylenol and my NSAIDs. But about 12 hours after my surgery, I remember being in the bathroom and being held up by multiple nurses, my husband hysterically crying, trying to squat down over the toilet to pee, feeling like my whole insides were just on fire. I was watching the clock, just waiting for the next time I could take another dose of my pain medication. I was taking 5 milligrams of oxycodone every 4 hours, which I knew the studies showed that this was a safe enough dose for breastfeeding. The next day after my surgery, I'm lying in bed, not even moving. And to this day, I can still feel just this gnawing pain. And I'm asking the nurses, like, let's try a lidocaine patch. I'll try anything. I just can't be in this much pain, laying here, not even moving. And I said, I need more ideas. I need to be up and moving. I can't just be sitting here dreading the next time that I'm going to have to get up to use the bathroom. And the nurse was like, okay, I contacted your OB. She'll be by as soon as she gets a free moment. So I got a little spicy and I was like, do I need to text my anesthesia colleagues? Like, what do I need to do to get some help? My OB came and she said, okay, I'll give you an extra dose of IV medication, outside of the other medication that I was getting every 4 hours. So I got one tiny dose of IV dilaudid 0.2 milligrams, which did help. But the best part is that later that day, a pediatric resident shows up to my room. He must have been maybe in his second year to talk to me about the safety of opioids and breastfeeding. Now, mind you, at this point, I had a week and a half left in my OB anesthesia fellowship. I had already completed 4 years of anesthesia residency a year prior, and bless his heart, he didn't tell me anything I didn't know, but I may have taught him a few things. This isn't a knock on anyone who took care of me during my C-section. If you listen to my podcast, you know how much I love and appreciate all of them. This is about the culture of not listening to women and appreciating their pain. Many women don't need opioids after their C-sections, and that is amazing. If you don't need opioids, please don't take them. But if you're one of the unlucky ones like me, you shouldn't feel bad about it. I gradually spaced out my pain medications, and I think I took my last one on day 8 after my surgery. This is a major surgery, and sometimes it requires major pain medications, and you deserve the appropriate treatment without judgment.